Hello. So I was wondering, just having a wondering, that because you've mentioned before about not like being touched, um, and just from just from the little discussion about that before you put the video on, you've almost prepared yourself, haven't you, in the way that you sit in. So how are you feeling now, just even in the conversation, because you know the conversation was coming, like you're guarding yourself already. Can you feel it?
I can see what I've done and how I've changed. And I guess for me, this is my comfortable position.
Yes.
This is it's just an automatic thing. I didn't think, oh, I've got to sit like this. It's just
No.
me default that I go to.
And were you going to say you said
Yeah.
you got, so almost like even just by knowing that I'm going to ask you the question about being touched, um, you kind of sat in a position, like we spoke about that, like that
Yeah.
before. But how's that feeling of not being touched, not wanting to be touched by anyone? How does it impact your life?
Um, I think that it's impacted like family and socially. Like my mum gets upset that I can't give her a hug and stuff like that. And like when you greet people and stuff like that, I just rather say hello rather than shake hands or have a hug, or everybody's into hugging now out there and stuff. And it's like, no, I don't. Um, but the big hurdle that I have with it, because it just seems to be assumed that everybody's okay with it, is when I need medical treatment or medical intervention or with screening and things like that. There's the assumption that you just have it done regardless. So, like this morning, I had an appointment at the hospital, and rather than thinking about what I was going for, what it might find, I'm just thinking, do they know I don't like being touched? Do they know my background? Well, I have to tell them my background. What if they want to touch me? What if they want to examine me? Well, should I tell them? If I tell them, will they look at me stupid and say, why are you telling me that? It's got nothing to do with what you're being here for, and stuff like that. And so it's a barrier in that it makes me feel as if I'm being awkward, because all my life I've been told I've been awkward. So it does. In the past, I have just gone along people pleasing and let myself be examined, um, because I didn't have the confidence to say please don't. There's been times when I have said I don't want to be, and I've been looked at as if I've got a major problem, as if there's some, as if I'm being not engaging, what they like to say, or whether I'm being an awkward patient. When I was taken to A&E, and the nurse just came in to do an ECG, and she just came up to me and just pulled my pajama top up
Oh,
to expose
wow.
myself. Now I started screaming and asked her to go away and leave me alone. She was like, but I'm just doing an ECG, and I felt vulnerable. I didn't know it was going to happen because I wasn't really with it. It was just suddenly having my chest exposed. And so I was
I
like, go
guess
away,
it's,
go away. And so in that respect, I was seen as being awkward or a bit of a challenge.
but I guess as well, from what you're saying, that sounds horrific actually. And I remember from a personal experience of being in a hospital where I know that the lady was trying to be helpful, but she literally just grabbed my clothing to take it down or off. And it's that where without thought, and so we do things without thought, don't we? We don't pause to say, how is that going to impact that other person? We often don't look at ourselves to say, how am I impacting that other person? You just look from your own narrative. So, and sometimes what can happen as well is that your narrative, you can be shut down a little bit as well, because how you've experienced that person's being awkward, because they're not letting us do what we want to do, instead of saying, let's give it some thought of what would it be like in their position. But even though you're giving it thought, you have to as well realize that it doesn't matter what label you have. What matters is what you're bringing with your label. So what they might be bringing, for instance, I had a doctor who was putting a tube down my throat, and he put the tube up my nose first for it to go down my throat. Now, when I went to one place to have it done, they gave me like a sedative, so I didn't feel the pain. But when I went for the first time to have it done, that was the second time when I went for the first time to have it done, I didn't know what that entailed because I'd never, if I'd experienced before, I don't remember. And so what the doctor did, he just brought his chair close to me and started to put it up my nose, and it was very uncomfortable and very painful. And he just gaslit me and said, "Oh, don't stop complaining. It's not that bad." Now, that's not kind of thinking. What is that like for that person? How do you know for that person that's not that bad? Because for me it was, but for him, maybe that's what he heard growing up. So you come in with a label, but you've got to be mindful of yourself. You know, when you, just because somebody taught me something and taught me to shut up about it, or taught me not to, not to express, or taught me not to, it doesn't mean that that takes away the right of another person to be able to, to do whatever they need to do for themselves, or whatever. So it's that where we can go into places thinking that people know better, when actually it's not, because we look up to labels, don't we? Look up to made up things, as I always say. But ultimately, you have an individual with a certain belief that they've grown up with, that they also take to work with them. And quite often, their belief for another person could be a big problem. Do you see what I mean? Because if you went to work and say there's a certain job that you wouldn't be able to do based on not being able to be touched, because as well as you not being able to be touched, you can't touch. Do you see what I mean? So there'll be certain places that you can't work in, but equally you know that. But there are certain people where there's certain things that they've grown up with, or what they might do, might go into a certain profession and start acting out certain things, such as, for an example, say you see people in old people's homes, if they've grown up in an abusive environment and when they were vulnerable, then how do you know they're not going to abuse that person that's vulnerable? And I'm not saying that everybody that's been abused, but ultimately, in certain ways, they do, because when we discussed that, even abuse towards yourself you're still a person. So, yeah, whatever is inside of us, if you're going to buy a tin of beans, unless it's got the wrong label on it, well, most of us do, but in this case, it's all you're going to get out of the tin is a tin of beans. So if you've got whatever in a bag, as I say, shit in a bag, that's all you're going to get out of it.
And because, like, that, what might be helpful or comforting for one person might be really distressing for another. So I'm not saying that there was any
so there wasn't
bad feeling, right? When I said I'd been in there 8 hours and I didn't have the confidence to say I needed a wee, but it got to the point where I had to. So I said, can I go to the toilet? And because I was unwell, she probably thought she was being helpful and got me a bedpan, but grabbed my legs to help me. Again, I started screaming, go away, leave me alone, because I would have just preferred to struggle and get up and go to the toilet on my own. But she went, again, with that, well, I'm perceiving with that awkwardness. Well, she asked that she wanted to go to the toilet, and now I'm trying to help her. She's just told me to go away, and not understanding. And I think
I guess as well, what you're saying is sometimes not being able to explain, because you shouldn't have to explain. Like you said, you feared, do I have to tell everyone?
Yeah.
Everywhere I go, do I have to explain to them?
Do they already know? Is this, you know what I mean? It's like, all I knew was I had this appointment at this time, at this location. I didn't know what had been written on the referral, how much they know about me, or so it was all the what ifs or will there that I had to deal with this morning. And because what I find is, if you tell one person, they'll respect it. But then when you see another professional, it's not passed on or it's not documented. My particular issue that springs to mind is the issue that I have with smear tests. I've never had one. And very early on, when I was first called for one, I just ignored it and I kept getting letters and getting letters and texts and emails and stuff like that from the doctors. And it was making me feel badgered, that it was like, you've got to come for one, you've got to come for one, you haven't been one. And I went to my GP about something else and I just said, oh, and by the way, I'm never going to have one. I don't want one. Can you stop sending me those reminders because it's upsetting me? And not a problem. I'll stop getting. Didn't ask me why or anything like that, but knew that I was very firm in my way that I spoke. And he said, not a problem. So for 20 odd years, I never got a reminder or anything. And then it's been raised a couple of times since then this year when I've spoken to different medical professions. Not about that, they've brought the subject up. I haven't been for that. Oh no, we can't do that. I'm like, well, you've been doing it for 20 years. Oh no, we can't do that. Or, are you sure? What if it's a woman? Are you sure? And it's like, I've said what my view is. Don't try and persuade me to do different.
I think as well, from seeing it from that point of view, is that you know, when people believe in certain things, don't they, because that's what they're taught. But that point of where I kind of think in society, the Stockholm syndrome. So people will do certain things, but will then trust them again. Because we're being brought up to trust them, it kind of doesn't matter what they do. So it becomes where, you know, since COVID, when you add fear around society, that you'd be, as I say, rejected by your tribe if you didn't go along with what everybody else was saying. And so for you, when you don't like being touched and things like that, and especially going to have something you didn't want to do, and you mentioned that you didn't want to do it, and you didn't want to have the injection, but you had it out of fear of being rejected, fear of being punished for not having it done. Similar to when you were abused, just go and get it over with. But as well, it's that when you look at it and then when you see it now, because there was the conflict is that's giving you more confidence into saying no, from what we've discussed, is that you can see that the aftermath of that, of what that did, it incited fear into people. It incited manipulation, what they call it, as I say, psycho-ops. It incited manipulation to say, well, everybody's doing it. Well, if everybody's doing it, I need to do it because I need to be part of that tribe, or I'll get rejected. So it's just part of manipulation. If you don't do it, you'll get attacked. If you don't do it, there'll be a consequence. So you can see that we're in a prison, can't you? From that, it's comply or else. And so that's that is a form of prison. So, but only there's no shackles around our necks, not the ones we can see anyway, but they are in our minds. And so, but also, barely any apologies for that, for afterwards. There was lots of attacks before by professionals as well that were following something. But also you've got to learn as well is when these things come about now, people are becoming more mindful to say, who's going to benefit? Who's going to make money off my body? Who's making money from this? And because of the aftermath of that, it can be, well, you keep not only with that to have an injection all the time, or you need to have this, you need to have that, you need to have that, then it poses the question, how much of this is true? How much of this, because that was fear-based that worked very well, how much of the other things that they're making money off is fear based?
Mm.
Why do I need fear if I'm naturally defective? Why do I need fear to get me to do something?
Mm.
Doesn't it mean that when the body isn't as defective as we're being told it is? Isn't it just something that we're putting in it? Because I can only say from what I see that nature is well, animals are well. The only thing animals that I see that get sick are the ones that eat. I can't remember which country it was, but they'd said that we eat cat food. So is the ones that eat cat food, I guess. I'll just go with that. Isn't that making us sick? All this food. Somebody thought, oh, it's just a few E numbers. Like, but these E numbers are working wonders, aren't they, for our health? Aren't they? Aren't we just eating one chemical to another? And so then, isn't that is that part of it? Is that why you're able to now say no?
Mm. think I think I'm still, depending on who it is, there's still a lot of situations where I will back down and I will just conform, and like I did with the COVID vaccine, because I didn't realise, but it was resonating with being abused as a child, because it was, if you the messages that I saw on the television and in the media, if you care about your family, if you care about people and old people and this, that, and you'll have the vaccine and this,
But
that, and
that's a
the other.
great
Yeah.
manipulation. Why would people have to be manipulated into something where it's like you're literally telling them, the gaslighting them? That's a form of manipulation. It's like the psycho-ops where you manipulate people to say, if you don't do what I want you to do, that means that you don't care about people. It's
Yeah.
like, no, I care about people. I care about a lot of people. I don't care for that. I don't care for people to be injected with stuff. And it's like, I remember seeing that somebody had said, what's in it? And this doctor had said, all good stuff. And my thoughts were, if that's all good stuff in that, nature only grows good stuff. It only grows good stuff for us to eat. Then give me the recipe and I'll eat it. So if it's all good stuff, but it isn't,
No.
it's been said that it's not. And so then who can you trust if somebody doesn't know about something and they're promoting it? Or do they know about something and they're promoting it? Then how can I then go back and trust that person? That whatever now marks that, whatever now you promote, how can I believe that that's in the best interest for me, for my body? If you've done that big, do you see what I mean? Because my first question is, when I didn't have the vaccine, I want to know what's in it. I want to know what that's going to do with the body. And I couldn't find the answer. So it's like, no, then. No. Do you see what?
That whole COVID incident really changed me about how I um, receive and respond to guidance from places like the NHS or the government, because it did really click with, like, it was a recurrence of the abuse. Like I said, you've got to have it, it makes you a good person, da, 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 go along, even if you don't like it, go along with it. And I
Oh,
didn't know
what's the
what was
saying as
going in.
well? There's a saying for people, many manipulation sayings is, a bit of what you don't like does you good.
Mm.
When did, no, it doesn't.
And it's like, when I had the vaccine, I felt there's something going in my body that I don't know what it's going to do. I was physically ill after it. I was in bed for a week or two with really bad pains in my head, and I couldn't lift my head up. But yet the message that I was still being received was, well, never mind, you've got to go through it again, have a booster. And it just resonated with the abuse, that no matter what impact it had on me, and if I said, I don't want to do this, it was like, oh, never mind, you've got to be a good person, you've got to carry on. And it was like, it just mirrored that.
Yeah, because it's that way. You're told not to care about yourself, that you have to care about others, but they are themselves. Do you see? So who am I caring about? Who was I caring about by having this that you're telling me that I should have by fear, I was caring about the ones that were making money off, but I wasn't caring about anybody else because they've too been harmed.